So thank you for joining us this evening. This session is also being broadcast on Facebook Live already. If you have any questions or comments, please feel free to use the chat function on either Zoom or Facebook. The Dementia Society of Ottawa and Renfrew County is thrilled to have you with us this evening for the opportunity to talk about women's brain health in Ottawa. And my name is Julie Ireton. I'm a reporter, senior investigative reporter with CBC here in Ottawa. And I've spent much of the past year covering the pandemic in my reporting, and a lot of it in long-term care issues, which touch on obviously issues affecting families, affecting healthcare workers, and people with dementia, so many of whom are in our long-term care settings. Dementia is also an issue that affects my family. My father-in-law was diagnosed with dementia a few years ago, and since then we've watched this former university academic really slip away from us. So the isolation of COVID has created a great deal of stress and uncertainty in our lives as we, strive to keep things as normal as we can during COVID and times of isolation and the stress that the pandemic has brought. And now we're actually seeing early signs of dementia with my mother-in-law. So I'm not just going to be the guide for you this evening, but I'm really looking forward to hearing from the speakers and gleaning information that will hopefully we can use in our family as well. This is the first event in a new initiative on this topic to explore the impact of dementia on women. They've been diagnosed with dementia or impacted as caregivers, paid or unpaid, family members and friends, someone living with dementia. We know that the impact is far-reaching, and we know that there is hope and there are things that we can do for our own brain health. And that's what we're here to talk about this evening, and look at future opportunities where and when we hope you will also join us. Feel free also to cite any of the stats in the infographics that are going to be shown in our presentation tonight. So to kick us off, I'm going to introduce you first to Wendy Grimshaw. She's the Chief Executive Officer of the Dementia Society of Ottawa and Renfrew County. Wendy is also the Chief Brainy Activator, a term coined by the Dementia Society, and it means she cares deeply about her own brain health. Welcome, Wendy.
Thanks, Julie. I love that title. So good evening, everyone. We're so thrilled you could join us this evening in such great numbers. And it's both my job and my pleasure to tell you a little bit about our organization to get us started tonight. So we started in this community 40 years ago. Rumor has it at a kitchen table somewhere. And we have a long history of innovation in supporting those affected by dementia. And if you actually looked across the country and looked at the programming, a lot of that programming actually started right here in Ottawa and Renfrew County. And so today's Women in Brain Health session is another example of us trying to lead the way. So you can see on this slide, we're funded by the Ontario Ministry of Health to provide a number of things: education, personalized support, and activities for people living with dementia and their families. And I really feel that we bring such an important perspective to the work we do and the services we provide, as many of us at the Dementia Society, like Julie was speaking about, we are or have been caregivers. So my mom has dementia, my grandmother had dementia, my mother-in-law had dementia. So we truly do understand what it means to feel when you're at the end of your rope, when you don't know what to do, when you're deeply exhausted, when you have guilt. And we also know what it feels like when you're able to reach out somewhere and get help so that you don't face this alone. And so that's what the Dementia Society is here for. And we know our services are needed more than ever. There's currently a shocking number of 24,000 plus people in Ottawa and Renfrew County diagnosed with dementia. And that number, even more shockingly, will double by 2030, which does not seem so far away. So if we go to the next slide, if we can. So why women's brain health and why now? So you can see from this slide that the majority of caregivers are women, and caregivers are heavily affected emotionally, physically, economically, and we often don't understand what those impacts are or how to support those people. And then if we go to the next slide, when we talk about women with dementia, so the stats are really compelling. So women are diagnosed 2 to 1 compared to men with dementia. Women also live longer. So the question is, are women more at risk because we live longer, or is there something unique about women that increases our risk for dementia? And that's what we're here to explore. We figured now's the time to explore this topic of conversation about women and brain health. And while we might not have all the answers, we want to start this conversation and are committed to providing you with some trusted information and a space and a conversation to explore this issue. So thanks for joining us tonight for what I suspect will be for many of us, myself included, the first step in our own brain health. Back to you, Julie.
Okay, thanks, Wendy. I'd like to introduce you to our keynote speaker this evening, Nafisa Ismail. She's an associate professor at the School of Psychology at the University of Ottawa and the holder of a university research chair in stress and mental health. She obtained her PhD from Concordia in 2009, and she then completed her postdoctoral fellowship at the University of Massachusetts and joined the University of Ottawa in 2012. Her research expertise is in the neuroimmunology and neuroendocrinology, and she was awarded Young Researcher of the Year by the University of Ottawa and Early Researcher Award by the Province of Ontario. She was also awarded the Prize for Activity in the Media and in the Community in 2021 by the Faculty of Social Sciences, and she's also a member of the Global Young Academy. It's a lot of credits to her name. Thanks for joining us. Welcome, Dr. Ismail.
Thank you very much for this generous introduction. It's truly a pleasure to be here. I also want to take the opportunity to thank Kate for inviting me and for all her colleagues that were involved in organizing this event. I'm really truly honored to be here. So good evening to you all, and thank you for taking the time to join the event today. I'm excited to get to talk to you today about how memories are formed and memory-related disorders, sex differences in the prevalence of memory-related disorders, and also how we can try to preserve a healthy brain. So to begin, what is memory? And for me to be able to define what memory is, let me first explain to you what learning is. And learning is what allows us to extract information from our environment so that we can then make relatively permanent changes in our behavior that will result from the experience that we've had in our environment. And memory is what allows us to learn. It allows that learning to persist over time. It allows us to acquire information, to store it, and then to later be able to retrieve it when we need it. But let me begin first by telling you how impressive your memory is. If I showed you 2,500 different faces for 10 seconds each, and later showed you 280 of these faces along with other faces that you haven't seen, you will be able to remember with a 90% accuracy the faces that I showed you previously. Pretty impressive, right? Our memory is just simply amazing. And we really have to be thankful for our memory. Our memory allows us to remember who we are. It allows us to remember where we live, to recognize people that we know, to navigate in our environment, to speak a language, to remember our past and build on these memories to live the present and then go into the future. Memory is really essential to our lives. It essentially defines us and makes us who we are. But how are memories formed? So In order to be able to understand how memories are formed, I'm going to be talking also about different types of memory. So it all begins with our sensory organs that are going to capture information within our environment. So our eyes, our ears, our hands, everything is going to acquire information that's present in our environment. All this information is sent to our sensory memory, where here the information can only last for less than a second. So the sensory memory is bombarded by information that is coming from all of our senses. And so only the information that catches our attention is then going to be sent to our short-term memory. And again, here, the short-term memory has a very limited capacity. The information in our short-term memory can only be stored for less than 1 minute. So it's only the information that our short-term memory judges as being important that will be transferred over to our long-term memory. And it makes that judgment about whether the information is important or not, depending on what we do with the information. So if we're rehearsing it, then for the short-term memory, this means that it's important information and it will transfer it to the long-term memory. So for instance, if you just met someone, you want to remember their name and the person was great and you're hoping to meet them again, you're probably going to repeat the name a few times. The short-term memory is going to judge that information as being important and will transfer it to the long-term memory. The long-term memory doesn't have a capacity. So here we could keep the information for essentially our entire lifetime. And then we will be able to retrieve that information when we need to work with it again. So if the short-term memory needs to re-access this information, it will retrieve it from the long-term memory, and then we will be able to process that information and work with it. And this is why we also call our short-term memory working memory. So where is this information stored in our brain? When you look at an active brain, it essentially looks like the image that you're seeing here, an immense network of electrical wires. But when you zoom into it, you'll see that it is made of 100 billion neurons that are interconnected. And this is what allows communication between various brain regions. And memory is a complex system that involves numerous brain regions. So it is not located in any specific area. Memory is formed, processed, and stored really throughout the brain. Now, what we do see is that certain pathways are going to deal with specific types of memories, but it is not specific brain regions that are going to encode specific types of memory. So it's really spread throughout the brain. So how is the information embedded in our brain? Well, what research shows us currently is that it's through neuroplasticity. But of course, this is still a process that is highly researched and we need to understand it more clearly. But for now, what we do see is that when there is new learning that occurs or when memories are formed, we see new neurons that appear. We also see new neural connections, so new synapses that become present, so more connections between existing neurons. And we also see changes in biochemical signaling within the brain. So for instance, in certain brain regions, we are going to see increased neurotransmitter release. So we all have these moments where sometimes, you know, we know the person, the face is so familiar, but we just cannot recall the name. Or we go into a room to do something, but once we get into the room, we don't remember what we had entered to do. What's important is that we will eventually be able to remember. So if we just give ourselves a few minutes, a few hours, the information will come back. And that just tells us that the memory is intact, but it was just a bit slower at being retrieved by our short-term memory. So this is all normal. We all have these moments, And as we age, these moments become a little bit more frequent. But what's important here is that the information does come back. What's not normal, and it's more common as we age, but it's signs that maybe we need an intervention. That's when we're having a conversation with someone, but we're forgetting important details within that conversation. So somebody just told us an information and we just cannot recall what that information was. Or we're having a conversation with someone and we're repeatedly asking the same question over and over again without remembering that we just asked that question. And it's also problematic when we're not realizing that we're forgetting, but other people are having to tell us that we are forgetting. So essentially, the problem becomes when we are forgetting that we are forgetting. And that's where it will be important to consult professionals and see if indeed maybe we are suffering from some form of memory loss. And it's important to seek the help if that happens, because what we'll see is that eventually memory loss is going to begin impairing our independent daily functioning, such that we will forget to take our medication, forget to pay bills, have issues driving around, forgetting ingredients while we are cooking or leaving the stove on, forgetting to tidy our living environment, and also forgetting to clean ourselves. So also personal hygiene can be compromised. And when this is happening, it could be problematic because it could affect our safety as well as our health. So it's important that we understand what could underlie the memory loss and if there is a need for an intervention. Essentially, we want to identify whether we may be suffering from dementia. And so what is dementia? Dementia is the medical term that applies to memory loss, and it is significant enough that it will impair an individual's daily independent functioning. And there is different levels of dementia. So there is mild dementia, where sometimes you may require help to pay bills or medication. There is moderate dementia, where we may require some help now dressing or in personal hygiene. And then sometimes it's quite severe dementia, where we will really need help on all facets of our daily functioning. And what we see is that the prevalence of dementia and its primary cause, Alzheimer's disease, increases as of 65 years of age. So once we turn 65 years of age, every 5 years, we are going to see a doubling in the prevalence of Alzheimer's disease. And we'll get to that later, but what we're going to see is that it's even larger for women than it is for men, but we'll get to that in a moment. In Canada, we see that currently there are about 1 in 5 Canadians that have experience caring from someone living with dementia. It is estimated that we currently have 564,000 Canadians suffering from Alzheimer's disease or other forms of dementia. And by 2030, we are estimating almost a doubling of these cases. So we are predicting that there might be 912,000 Canadians that would be suffering from Alzheimer's disease or other causes of dementia. The economic cost currently is estimated at 10.4 billion annually in Canada. So you can only imagine what that cost will look like in 2030. Now, of course, these estimates were made before the pandemic, and now with social isolation and all the restrictive, the regulatory measures that have been put in place, these are all factors that can exacerbate Alzheimer's disease. And so it is a possibility that we may reach 912,000 Canadians much earlier than 2030. So let me give you a little bit of history about Alzheimer's disease. So Alzheimer's disease is named after Dr. Alois Alzheimer, who in 1906 noticed that there were some changes in the brain tissue of a woman that died from an unusual mental illness. He noted that the woman had symptoms of memory loss, language problems, and some unpredictable behavior. And so with the consent of this woman, after her passing, he was able to examine her brain. And what he noted was some peculiar abnormalities in the form of clumps that we now call amyloid plaques, and also these tangles of fibers that we now call tau tangles. And when you look at the full brain, just visually, you do see a huge difference between a normal brain, which is what you are seeing in B, and a brain from a patient suffering from Alzheimer's disease, which is in A. So you see this shrinkage at the level of the cortex, where you see a lot of empty space in between the folds of the cortex. So what are some of the risk factors that have been identified for dementia? There are several, so we're just going to go through them a little bit group by group to make it easier. First, there are certain risk factors for dementia that we have absolutely no control over. There is the genetics. So some of us are just more likely to develop Alzheimer's disease than others. There is aging as well, as we discussed earlier. So as we age, after 65 years of age, it becomes quite a bit more prevalent. And then there is sex too, which we'll get back to it. And we see that women are more likely to develop dementia than our men. There is also all the other risk factors that affect our cardiovascular health. So high blood pressure, smoking, diabetes, obesity, lack of physical activity, poor diet, alcohol consumption. And then there is also other risk factors that we can change and we can try to improve on. And those are when we have low levels of cognitive engagement, depression, traumatic brain injury, hearing loss, social isolation, air pollution, etc. So I just want to draw your attention now on this sex as a risk factor, and I would like to take a few moments to talk to you about it more. This here is data that was published in 2010 by the Alzheimer's Society, comparing the incidence of Alzheimer's disease across different age groups by gender. And what you see is that in 2010, it was reported at each of the age groups, you're seeing that women are much more likely to develop Alzheimer's disease than men. And now we know that these numbers are even higher. So with time, this has become even more of an issue. And in trying to understand what are the factors that contribute to this sex difference in the prevalence of Alzheimer's disease, we have come to realize that we know so little, and there is so much more work and research to be done in this area. The reality is that in the past years, health of women has suffered quite a bit with the lack of research funding that was being put in areas that were specific to women's health, and even more particularly women's brain health. Luckily, this has been changing in the last few years, and there has been some progress made, but there is still so much that we need to learn. At the moment, what we do see is that higher longevity could contribute to women having more prevalence of Alzheimer's disease. But this makes sense when you're thinking of individuals that are 80 years and older, but not 65 years and older, you know? So higher longevity would explain it for older age groups, but not in middle-aged or middle-aged adults. So what are some of the other factors? We see that hormonal changes that women experience during puberty, during pregnancy, post-pregnancy, during menopause. These are also factors that could contribute to the development of Alzheimer's disease, because when we see hormone levels increasing or decreasing throughout the lifespan, we do see changes in neuroplasticity in the brain. Stress is also a factor that impacts the prevalence of Alzheimer's disease. When we undergo chronic stress, for instance, we are going to see impairments at the level of neuroplasticity. And we also know that women experience different types of stressors than men do. Women have different types of responsibilities. They tend to be often the ones that are completely managing the household, managing schedules of everyone, children, their own schedule, their work. And so the type of responsibilities that women tend to take on are different than those of men. And this could increase their prevalence to Alzheimer's disease. Because with that added stress and these added stress factors, there's all the emotional stress that comes with it, where there is a feeling of a lack of appreciation, a lack of help, a lack of support. Women also tend to be primary caregivers, so primary caregivers for their parents, their spouse, their children, grandchildren, etc. So it's a lot of responsibility. There's also the possibility that there might be certain health conditions that might be specific to women that may contribute to the increase of prevalence of Alzheimer's disease. For example, obesity tends to be a factor that is greater in women than in men. And so that we know obesity is a risk factor for Alzheimer's disease. So that could also explain. So, and then there is also some genetic component to that. This is more recent research that has identified the ApoE4 alleles, which is an allele on a gene. And when we compare the presence of this allele between men and women, what we find is that women who carry this allele are going to show more amyloid beta plaques. They are going to show greater and faster cognitive decline. And they are also going to show a reduction in the volume of the hippocampus, which is a brain region that is so critical in memory formation. So how can we preserve a healthy brain? When we think of wanting to preserve a healthy brain, then we, of course, want to do so because we want to preserve our mental health and also our cognitive function. And so maintaining a healthy brain is not any different than maintaining a healthy body and a healthy mind. And there's a number of things that we can do as individuals to try to preserve a healthy brain. So first of all, we must be physically active. And what is recommended is a minimum of 30 minutes of exercise per day. And here we're not talking about, heavy cardio exercise, just a simple walk, 30 minutes per day is sufficient. Sleeping well is important. It is recommended that we sleep a minimum of 7 hours per day. If you are an individual that takes a long time to fall asleep or that you wake up regularly during the night, then you need to take that into account and go to bed earlier so that you can ensure that you get that 7 hours of sleep. Identify the factors that stress you and reduce this stress. So reduce these factors. Avoid smoking, excessive alcohol consumption. Keep your blood pressure, cholesterol, blood sugar, and weight within the recommended range. Stay socially active. When we are socially active, we are happy, our brain is working all the time, it's getting challenged and so on. That's important, and it will help us maintain a healthy brain. Make healthy food choices, and we'll get to that in a moment again. But make sure that you're engaging and staying active and keeping your brain active. So challenge it, play games. And here I'm not talking about those brain games that you find online, but play social games, you know, so get together with friends when possible, with family, play cards, chess, checkers, anything that will stimulate, that will make you happy. Try to learn new things, whether it's a new skill, a new language, all that will help. Take care of your hearing. In order to preserve a healthy brain, we also need to make sure that all our sensory organs are working well and at their best capacity. So avoid being exposed to loud sounds because you don't want to lose your hearing. But if you do see that there is some impairment in your hearing, wear a hearing aid and don't hesitate to make sure that you're finding that right hearing aid for you, the one that's most comfortable and that will allow you to wear it all day. Lower your risk of fall, because we have seen in research that when individuals fall, and especially when they bang their head, there is a possibility of an impact on the neuroplasticity. So we want to make sure that we have everything in place to lower our risk of fall. And then, of course, reduce your exposure to air pollution. That will also definitely impact your neuroplasticity. So I just want to talk a little bit more about making healthy food choices. You know, we hear often about eat healthy, but it's sometimes unclear how it's exactly what we are eating is going to impact brain health and the neuroplasticity within our brain. Well, that's through our gut microbiome. Okay, so our gut microbiome is made of lots of microorganisms, bacteria, viruses, protozoa, fungi, and they collectively carry genetic material within the genetic tract. And this gut microbiome plays a very important role in maintaining health overall, but also brain health. And it also contributes to pathogenesis of diseases. So it goes both ways, and we want to make sure that we maintain a healthy composition in our gut microbiota, because these bacteria are able to communicate with our brain through the gut-brain axis. And so what we do see is that when we are not eating healthy, so when we are not eating lots of fruits and vegetables, high fiber, probiotics, all that are elements in our diet that contribute to healthy bacteria within our gut and will help promote neurogenesis within our brain. So with that, I would like to end by telling you to simply make good food choices and feed your brain well, and try to do all these lifestyle changes that are going to help preserve your healthy brain. Thank you all for your time.
Thanks very much. That's very interesting, and some really startling statistics in those graphs for women especially. I think I've got some questions that I'm going to save for the Q&A, but first we're going to hear from somebody else. We're going to hear from Mary Alice McNeil. And Mary Alice is a retired family mediator who's been active as a volunteer in several organizations, including the Dementia Society. She's the daughter of Rosalie McNeil, and I'm hoping that Mary Alice is going to tell us a little bit about her. She's one of Rosella McNeil, yes, one of her caregivers. And Rosella is over 100 years old, living with dementia in a long-term care home. Welcome, Mary Alice. I think your microphone is not on, Mary Alice.
Oh, thank you. I'm good now. Can you hear me? This is good? Okay,
yeah, that's great.
Thank you for the introduction. There you're going to see some pictures of my mother, Rosella, and she was diagnosed about 8 years ago with Alzheimer's following an assessment by Dr. Dalziel at the Civics Geriatric Day Hospital. And her symptoms were short-term memory was significantly impaired. She had difficulty with problem solving, with organization, with attention. However, she performed well on some of the cognitive assessments. She was prescribed Aricept, a drug that helps to delay the progression of the disease. And then the following month, she was admitted as a resident to St. Patrick's Home in Ottawa. This was not because of her Alzheimer's, it was because she had been physically ill previously, and she was just, and a very advanced stage, so she was due to go to long-term care. So she adjusted well. She continued her normal activities. She was an avid reader. She knitted. She used her computer. Her last email I received the day before she turned 97. She had visits from her very large family. She has 8 children, 22 grandchildren, and at last count, 26 great-grandchildren. So things went reasonably well until 3 years later, at the age of 99, she suffered a fall and broke her hip. So after surgery, she was quite a different person. For several weeks, she was quite lethargic. She was nearly nonverbal, but she made a slow recovery, and in about 3 months, she was once again speaking with us. Now, over the intervening years, she has slowly lost more of her short-term memory. She's lost much of her ability to speak in sentences. She can no longer read or follow a story that's read to her. She doesn't knit. She really has lost nearly all of the activities that she once enjoyed. She has some confusion at times about where she is and what's happening, but other times she's really seems to be quite cognitively well. So sometimes she'll remark that, she should go home because my father, who's now deceased, shouldn't be living in that big house by himself, she'll say. Or sometimes she thinks her mother is alive and she asks us if we know how she's doing. But at other times, she's really a lot like her old self. She follows our conversations very well. She'll nod, shows us she understands, even though she's not able to verbalize her thoughts. So when the pandemic hit, she had no visits from us for 4 months. So we had weekly window visits, and we would go, members of our family would go and we'd sing songs, smile and wave through a window. But she couldn't hear us. Her hearing is poor, so the visits were not as helpful as they were perhaps to some of the other residents who had better hearing. But once we were allowed to visit her again, we found she was very quiet, quite lethargic, similar to the way she was post-surgery. She had regressed considerably, but once again, she made a slow but sure recovery, not back to where she was before, but we could see the improvement, a marked improvement, once we were back visiting her again. So now, 8 years after her diagnosis, she is now 104 years old. She's still able to recognize her children. She still gets a joke. She laughs at the punchline, and sometimes she amazes us by adding a comment that's very relevant and on point. So, and we can tell by the way she speaks, well, she speaks a little bit, but we can tell by the way she reacts, she looks at us or laughs. Her personality is intact. She is very much the same woman she was before in some ways. So, and I'm thinking about the information just presented to us by Dr. Ismail, and my mother seems to be an example of how her healthy lifestyle helped to delay the onset of her disease and helped to slow its progression. So she was a registered nurse, and throughout her life, she followed nutritional guidelines that are recommended today. As little kids, she told us about vitamins, the importance of eating fruit and vegetables, and she cooked meals from scratch. She stayed active. She worked as a nurse once her children were in school, and she remained at work part-time until she was 75. She exercised every day, well into her 90s. And I remember when she came to visit and stayed overnight, my goodness, I'd hear the floor creaking upstairs when I was making breakfast because she was doing her morning exercises. She took the courses necessary to upgrade her nursing skills and retain her professional standing, so she was always learning. And most of all, she was an engaged mother and grandmother, and she stayed very much involved in the lives of her family members. So in terms of our family, my siblings and I have always been involved in her life and supportive of her. In her case, because of her advanced age and the previous physical illness, she was admitted to long-term care very shortly after her Alzheimer's diagnosis. So our families had an enormous amount of support from long-term care staff. We do visit her nearly every day, but we've not had the level of worry and stress that other families have as their loved one declines and they find their resources are stretched to the limit. However, despite all of this wonderful support, our mother's declining health has taken a toll on us, and we support each other by sharing strategies for communicating with our mom, for feeding her, keeping her comfortable, helping her to manage her emotions. And we share with each other, my siblings and I and our children, our feelings of sadness and worry about our mom and grandmother. We tell each other all the time how much we appreciate all of us pulling together to help with her social, emotional, and physical care at this difficult stage of her life. And I must say the Dementia Society has been a great source of information along the way. We've benefited enormously from, the information on the website, the tips on communicating with people with dementia. We learn from the videos that they, are provided on the experts, provided on the website, videos of experts in the field and webinars such as this. I'm also a member of an online support group, the Dementia Society support group. So at the outset of the pandemic, when I wasn't able to visit my mom, I found myself wishing I could help in some way, however indirectly. And then when an opportunity arose to volunteer with the Dementia Society, I became involved and have very much enjoyed learning more about the services it provides to those in our area who are caring for family members or friends living with dementia. And I'm really very impressed by the dedication and professionalism of the staff, and I'm grateful for the opportunity to support their efforts. Thank you.
Thanks very much. It's good to hear that you've had such good support from both your family and St. Pat's and the resources that are available from the society. I think not everyone realizes the resources that are out there when they're in a situation like that. So it's really good to hear firsthand. I am going to hand the virtual microphone back to Wendy Grimshaw. She's, of course, the CEO of the Society, and she's going to tell us about an exciting new Dementia Society initiative.
Thanks, Julie, and thanks, Mary Alice. So we've heard a little bit today about how dementia affects women differently and more frequently, both in terms of getting the disease, as well as the stresses of being a caregiver. So where to next? So we're thrilled to announce an internship called the Dr. Marguerite Ritchie Internship that we're going to use to develop a whole program around women and brain health. We know it's a really important issue. And so our intention is to launch a free new program later this year. So a little bit of background about Dr. Ritchie. She passed away in 2016 at the age of 96. You can see her picture there. She had a Bachelor of Law degree from the University of Alberta and then did her Master's of Law at McGill. She was the first woman in Canada to be appointed to the Federal Queen's Council. And in 1974, she founded the Human Rights Institute of Canada, which is a not-for-profit organization whose mandate it was to ensure equality and justice for Canadian, particularly for women and Aboriginal women. And in 2000, she was appointed to the Order of Canada for dedicating her life to the advancement of justice and equality and for advocating for change and the equality of women. And this was, just one of the many awards she received in her lifetime. So her executor, Pat McNaughton, directed the remains of her estate to us, asking only that we do something fitting with the funds. And so she's very proud of the direction we're taking with this internship, and we're honored to celebrate her legacy with the creation of this new program in her name. So we're really, stay tuned for details. We will really appreciate your thoughts and comments and areas of inquiry you'd like us to build into this program as we develop it. So back to you, Julie. Thanks.
Great, thank you. So we're now going to switch into the question and answer portion of the event, and it's your chance to ask any of the three panelists some questions. Now you're also welcome to type your questions into the chat box, or if you click the virtual hand, put your hand up, you can ask your question directly, and the panelists are going to try and answer the questions in the time available. But if you want to have some follow-up, you can email at info@dscrc.org and include WBH webinar in the subject line. So that's something to keep in mind if you don't get a chance an opportunity to ask your question. Now I had a couple of questions myself, but there are already 8 questions or 9 questions I see here. So I'll go ahead and ask for some of these folks. The first question is, how frequent is dementia is genetics? How frequent is genetics a cause of dementia?
It's quite frequent actually, and it's more frequent when Alzheimer's disease is developed younger. So what we see is that before 65 years old, when we do see the presence of Alzheimer's disease, it's mainly because of the genetic background of the individual. But it's only as of after 65 years old that we see that aging and other lifestyle factors start to influence. We are also going to see that when genetics is the primary cause of Alzheimer's disease, that the cognitive decline from it is also unfortunately much steeper, so much faster than when it is due to other factors.
Okay, I mean, the same person asks if her mother has dementia, how likely is she to get it? And then there's a similar question: is it true that if I have a parent with dementia, that I have a 50% chance of ending up with the same diagnosis?
That's an excellent question. To really be able to accurately answer this question, we would have to do genetic profiling. So it is best to see a genetic counselor to be able to do that diagnosis more accurately. And it does not necessarily mean that you have a 50% chance of developing Alzheimer's disease. So there is no need to panic, but of course you want to know what your chances are so that you can better prepare and at least try to do the right things that are under your control to try to preserve brain health as much as possible.
Some of the interesting things that you were talking about that caught my attention was hormones and the question of hormones. And somebody is asking, are there any known links between dementia and Alzheimer's disease risk and oral contraceptives during a lifespan, especially long-term use of oral contraceptives or IUD use?
That is an excellent, excellent question, and actually one that I'm very passionate about. You would be so surprised to see how little we know about the impacts of oral contraceptives on brain health. We know some about their consequences on overall, like health in the body, but there is very little that we know about what it does in the brain. And there's recent work actually from my lab that shows that when we do take oral contraceptives, women that are under oral contraceptives show differences in gray and white matter volume within the brain in specific brain regions, particularly in brain regions that are involved in emotional processing. And we also see that the brains of these women become a lot more active when they are presented with negatively relevant emotions, so with images that are negatively charged. And so that their brain all lights up completely, which we don't see in women that are simply naturally cycling. We also see an effect of age of onset when we start taking oral contraceptives. So we see that women who began taking oral contraceptives very early on during puberty and early adolescence, not necessarily because they were sexually active, but maybe to regulate acne, menstrual cramps, PMS and so on, the effects are even larger in these women. So there is definitely an impact of oral contraceptives on the brain structure, on the brain function, but exactly how it is, whether it is linked to Alzheimer's disease is still unknown, because we're just beginning to unravel the effects now of oral contraceptives on the brain. And this goes back to the point that I was telling you before, that for so many years, we neglected women's health and issues that were unique to women's health. And luckily this is changing, but we're so behind in the research, unfortunately.
Right. Well, that's really interesting, because obviously oral contraceptives is a generational thing, and you're just starting to see that generation, I guess, develop dementia. There's also a question about strokes, and if there's any evidence of an increased risk of dementia following a stroke.
Yes, there is. That's a very good point. So there is definitely a link between the vasculature and blood flow within the brain and Alzheimer's disease. So in situations of stroke where there has been blockage at the level of blood vessels, we do see that this can precipitate cognitive decline.
Okay. At what stage should preventative medicine begin?
As early as possible. So as early as possible. And I would say first begin with lifestyle changes, eating healthy, trying to reduce stress. Now that we know that these are important risk factors, the earlier we try to avoid them, the better it is. So as early as you can, yes, and it's never too late. It's never too late. So don't hesitate to engage now in these lifestyle changes.
The other question about this is natural remedies. And, we hear about things like ginkgo biloba and other things that might help with memory issues. Are there natural remedies that to keep the brain in tip-top shape, this person asks?
And thank you for clarifying. So, when it comes to these sort of natural remedies, I would say there is unfortunately not enough research to really say that they are improving cognitive function. What is beginning to be revealed now in the scientific literature is probiotics. That probiotics are effective at helping with cognitive function, memory, and also seems to slow down cognitive decline in individuals that are already expressing cognitive loss. So probiotics help because they act at the level of the neuroinflammation that we typically find to be higher in individuals that are suffering from some form of cognitive decline. So probiotics help reduce that neuroinflammation, and so it helps preserve cognitive functions longer.
There's a question about whether or not genetic testing is available in clinical settings, and if so, would it be beneficial? And I know that you were talking about some testing earlier, and I wonder, just as a supplement to that, if there's a difference between testing available for Alzheimer's and testing for dementia.
Mm-hmm. Yeah, so I think that the testing that is available is for Alzheimer's disease, not really for dementia. But knowing that Alzheimer's disease is the primary cause of dementia, it is likely that eventually the Alzheimer's disease will lead to dementia. So you can conclude it that way from the results that you get. But I would recommend also that you only do the genetic testing if you're really ready for it, because you don't want to then be stressing for the rest of your life with the results that you have gotten and spoil the precious years that you have and so on. And so, make sure that you're ready to find this out, but don't let it overtake your life. That's essentially what I'm trying to say.
Right. Yeah. There's another question about this one about hormones. and she's interested to know if there's been any research related to hormone replacement therapy and whether it has any potential impact on brain health.
Yes, so actually there is. And hormone replacement therapy following menopause has been shown to result in improvement in cognitive function. Because during menopause, we do see a sudden drop in estradiol levels, and estradiol is so important in maintaining cognitive function. So we do see absolutely benefits of hormone replacement therapy during and after menopause. But as we know, there are also increased risk of developing breast cancer with hormone therapy. So there are benefits and risks to weigh. And of course, that's an individual personal choice to make, but talk about it with your doctor and see what is best for you and how long it is appropriate for you to be on. And if it's not that long, it's okay too. Yeah, you just have to weigh the risks and benefits.
It's still on the medication question, but this one's about medication for depression, whether that would have an impact on the prevalence of dementia or Alzheimer's.
It does. It does, because suffering from mental illness like depression does contribute to the onset of Alzheimer's disease. So the quicker we are able to be diagnosed and get treated for it, the better it will be even for our cognitive function. So treating other aspects of mental health will also benefit our cognitive abilities.
Okay, I'm scrolling down here to see where I'm at. Probiotics. Not sure if you've answered all of them. Let's see. The question is, what is the best source of probiotics and dose?
So it's true that there are so many sources of probiotics available on the market, and you want to make sure that you are selecting the right ones. So what we have seen in research is that live bacteria are the most beneficial. So probiotics that you would find in capsule form wouldn't be as beneficial because the bacteria are not living anymore. But if you're able to get your probiotics from yogurt or from kefir, some sort of a lactic acid based product, that will be quite beneficial because lactic acid is essential for keeping the probiotic bacteria alive. So these are really going to be the most effective ones. And then read the label and make sure that it is high in concentration of two types of bacteria that are quite good. Those are lactobacillus and bifidobacterium are quite beneficial. So if you're able to find probiotic product with live bacteria, I would recommend from yogurt or kefir, you will find high concentrations of these bacteria in it.
Okay, this is great information. Maybe we'll just pause the questions, and if the panel can stay a little bit longer, we're going to take an online Zoom poll, and then if we have some time, we'll ask a few more questions at the end. So I think the slide is going to come up for our poll. So if you can, all of you that have joined us this evening, the Society would really like your feedback. And so if you can please take this poll that's now in front of you about what you want to learn about in future sessions. We're also going to do a book draw. I guess I can move on to that. We will be sending you an email tomorrow morning with a brief survey. It's going to have 3 short questions. Your opinions about the evening's events. From the list of completed surveys, we're going to randomly draw 3 names to win a copy of Save Your Mind, 7 Rules to Avoid Dementia by Dr. Antoine Hakim. And Dr. Hakim supports the Dementia Society in a number of ways, including the donation of these books. So anybody that sends in their survey, you have a chance to win this. I also want to remind folks that you can mark your calendars for the next event on the Society's calendar, which is March 8th. And that's going to be International Women's Day, and the topic will be informed by the feedback that the Society gets today. So we'll have details coming as to what the topic is going to be then. So if we have a bit more time, I guess we can go to a few more questions. Is that okay?
Yep.
That's okay with you? Okay.
Mhm.
I'll just,
Yes.
and if Wendy Grimshaw and Mary Alice are also available to answer any questions as well.
Happy to have Nafisa on the hot seat here. That's good.
Yeah. Well, she has lots of answers, and I know that so many of the questions have to do with the research that she's doing. So there is a question here. I'm going to start from the bottom and go up. Please provide a little more information about the impact of concussions on the prevalence of dementia. That's a really good question.
You are right. That is an excellent question. So with concussion, what we do see is that there is increased neuroinflammation in the area that suffered from the impact, but then that neuroinflammation also spreads throughout the brain. And that's problematic because the neuroinflammation, while we do have cells in our brain that are designed to clear that neuroinflammation, when there is just too much of it, those cells are not able to eliminate it. And that buildup of neuroinflammation is going to then lead to more tangles, to more plaques, and eventually those are gonna multiply, and then that's what then causes the cognitive decline that we observe following concussion.
Okay. There's a question here. Could Dr. Ismail repeat the names of the live bacteria we should look for?
Absolutely. So it's lactobacillus and bifidobacterium.
Okay. It says, please ask about thyroidism and dementia, if there's a connection there.
There is. Thyroidism is that type of disorder that seems to be connected to everything, right? So it's important to really stay within the normal range and make sure that we are medicated when we need it to be medicated to keep it at normal ranges. But definitely it does impact dementia on several levels, because we do see that with thyroidism, now depending on whether it's hypo, hyper, we're going to see a change in sleep patterns or ability to sleep well. Activity level is impacted, weight of the individual is impacted, and all these factors are also individual risk factors of dementia. So with thyroidism, you get a bit of a compounding effect where you have so many other factors that also become present.
Okay. There's one more question here. Does one need a referral from a GP for a DNA test for Alzheimer's, and where can that be obtained?
I'm not 100% sure, but I do believe that you need a referral from your GP. So if you are concerned about your likelihood or probability of developing Alzheimer's disease, don't hesitate to talk about it with your general physician. Mention it to them, and they might have also affiliations to specific clinics that they can recommend so that it may speed up the process for you. But yes, if you have a referral, it will definitely be a smoother process.
Okay, thank you so much, Dr. Nafisa Ismail from the University of Ottawa for sharing your expertise this evening and answering so many questions. It was great to see all these questions, and they're really smart and thoughtful questions, and we've got some really important answers and informative answers from you. Thank you also to Mary Alice McNeil for sharing your story about your mom and the experience that you're having. And so many people out there, I'm sure, are, have their own experiences with Alzheimer's and dementia and long-term care. And it was really good to hear about what your family is going through. Thanks to Wendy Grimshaw, the Dementia Society, for the exciting news tonight about the support for women's brain health and the internship. And thank you to the Morris Home Team for being the Dementia Society supporter of Alzheimer's Awareness Month. And of course, thanks to all of you for logging on tonight and for being with us and asking all your questions. We hope to see you at future opportunities and maybe even in person if this pandemic, when it's over, and we're doing things more in person. Until then, be well and look after your brain.
Thank you.
Thank you.
Thanks.
Julie.